Hello everyone and welcome to today's COVID-19 Ask the Experts video. So today we have the Director of Public Health for Medway Council, James Williams, and also Dr. Navin Kumta as well. So thank you very much indeed both for joining today, and a bit later on we'll be getting you to answer some of the questions we've had around the pandemic from various members of the public. So we'll touch on that a bit later. But just to start off with, if you could just give a brief outline in terms of your role and the work you've done in tackling the pandemic here in Medway and also across the county as well. So we'll start off with yourself, James, if that's okay.
Well, thanks, Kevin, and welcome everyone to this. I think it's going to be the first of many, as I've been told. So we better get this one right. So I'm James. I'm Director of Public Health for Medway, and one of my key jobs is to help to ensure that the population of Medway and also Kent, because I work in partnership with a whole range of agencies, including the Local Resilience Forum, and that's a multi-agency group that involves our NHS colleagues, our local authority colleagues, national government, other local government organisations to protect our population. So that's what we've been doing over the last 18 months.
Thank you very much, James. And hi, Navin. If you can give us an introduction as well, that would be fantastic.
Hi, Kevin. I'm Navin Kumta. I'm a GP. I practice in Ashford, where I'm also the clinical chair of Kent and Medway Clinical Commissioning Group. I think over the last 15 months working with James, it's been a work of understanding the data that's coming through, understanding the trend in terms of this nasty virus that we've had shatter our lives, and responding it what it means from a clinical perspective. So what's the clinical perspective of it? How does the clinical services work and respond to it? Things like you probably heard about the transfer of patients to other areas, coordinating that aspect of things like the assessment of people at home to monitor their oxygen, things like the vaccination program that's been running through. I think the input into that and the clinical perspective of that has been my role for the last 15 months.
Thank you very much, both. So yeah, incredibly busy, and the work you've done has been hugely appreciated across the county. So thank you very much. So let's look at the here and now then. So the current picture of COVID-19 in Medway. So obviously infection rate is very low at the moment, which is fantastic, and we know that lockdown has had a big impact on that, as well as the huge success of the vaccination rollout as well across the county and in Medway as well. So James, it would be great if you could give us an update just on what the current picture looks like for Medway, and obviously the roadmap easing further, hopefully on the 17th of May, how that looks like as well, and what we need to do to get to that next stage.
Thanks, Kevin. What I would like to say is that everyone within Medway, and also the visitors to Medway, and clearly those people that work and come through, everyone's been working really hard to get those rates down. And you mentioned that they're low now, they're at about 11.8 per 100,000, and that's well below at this moment in time the 25 per 100,000 that we want to keep it at. We want it to be as low as possible, but keeping it down around that level gives us a chance to be able to tackle any outbreaks or incidents that occur, and some will occur, because clearly while we've still got disease circulating out there, we will still unfortunately get some cases, and that's why testing regularly, particularly using the symptom-free tests, is a very important thing for everyone to do. So that roadmap that you mentioned, the 17th of May, currently we can meet outside, we can be in groups of 6 or 2 households, and we can go to restaurants, we can eat again in those kind of secure bubbles. After the 17th of May, we'll then start to be able to perhaps enter into indoor type meetings and going inside to venues and pubs and that type of thing. And doing all of that means that we've then just got to be on our guard. As the virus needs people to come together, to congregate, and inside is easier for it to get around, because we need to have ventilation, don't we? You've all have heard these messages about using space, i.e. space distance, so being outside so that the virus gets blown away clearly. And in the weather that we've had over the last few days, I'm sure that would have been quite useful. But the context is we've got to be on our guard. The roadmap through to the 21st of June is not too far away. And I would give praise, and I will do that, to our primary care colleagues and all of the other clinicians that have been involved in helping with our vaccination programme. Navin has mentioned that, and I'm sure we'll touch on that further, but we've had really good uptake and we want to increase that. We want everyone that's eligible now to come forward. You've still got time. You can still go online, either onto the NHS website, just www.nhs.co.uk, I think it is, and you'll find the links, or dial 119 and you can get access to that programme. So rates have trended down. We're in a reasonably decent place at the moment, but we cannot be complacent. The way to keep us there is for everyone to be vigilant. The usual things around our hand hygiene, face coverings and social spaces, abide by the current regulations, which anyone needs to find out what they are. Just go onto the medway.gov website and there's a whole list of guidance and support there, and links to some of the other information that you might need to keep yourself safe and the rest of the community.
Fantastic. No, thank you very much, James. And you mentioned there a number of things around, obviously, the infection rate and the success of the vaccine rollout as well. In terms of the availability of symptom-free testing, I mean, it's now never been easier in the county to get a test. How important is that for residents to use testing to help combat any outbreaks of the virus?
Well, as you hopefully will be aware, Kevin, Medway was the first area in the southeast, one of the first in the country to establish community testing at scale. Our symptom-free testing sites are all over the place, I would suggest now, because people can access tests from community pharmacists. You can go there, just pick up a test kit, take those home, and there's no issues at all with being able to use them. You can get guidance, and all the information's in the pack. We've got our formal test sites, and these are in Rainham, in Gillingham, over in Chattenden as well, and clearly in Chatham. And remember, there is a difference. If people are symptomatic, you got symptoms, please stay at home. You can order the kit to be sent to your house, and that's a PCR test kit whereby you will take a swab and put it in a packet, and it will get sent off for you, or go to one of the remote regular test sites. So we've got a regional test site in Rochester, and also another one in Chatham down at the dockyard. So if you're symptomatic, that's your lossy taste and smell, you've got a new continuous cough or a very high temperature that's unexplained, any of those three symptoms or one of them, please make sure you self-isolate, stay at home, get yourself tested in that way. If you're symptom-free, i.e. not sure about whether you're infected or not, and bearing in mind 1 in 3 people, unfortunately, that test positive and don't have any symptoms at all, then you can collect your test kits from either our asymptomatics, our symptom-free test sites in the locations that you'll find on our website, from your community pharmacists, and also from our regular regional test sites that provide symptomatic testing as well.
Thank you, Joe. Very, very clear there. And yeah, so many ways you can get tested, and yeah, and obviously how quick you can get your test result back as well is fantastic. So yeah, hopefully, obviously, many more households will continue to take up testing in Medway and across the county. The 17th of May is obviously fast approaching, and people may think, oh, it's so tempting now just to have my friends or family come round the house, just have a drink or a bit of lunch. How important is it that people do just keep on just staying outdoors, mixing with others, socially distance before the 17th of May, despite obviously the infection rates being low at the moment?
Well, it's really challenging. I think we all accept that when you haven't been with your friends, your family, and your loved ones, and then even meeting new people, to want to, because it's a human thing to get close, to shake people's hands, and to do things like that. We are so close. And let's give it a football analogy, if we will. You know, if you're fighting now as you are to stay in the leagues that you're in or to gain promotion, and that next game is so important. And let's say, abiding by the regulations, staying in the gardens, being outside. The weather can sometimes be a bit challenging, but equally so, that's the way to keep ourselves safe. After the 17th of May, there will be other choices that we can use to meet people inside. And clearly, the more that we do now to drive those rates of infection down, the more likely it is that it'll be much safer for everyone, and we will be protecting those most vulnerable people in our community. And I will again give my best heartfelt thanks to all of those people that have been out there, particularly the volunteers that have been delivering food parcels, delivering medicines, dropping in on people virtually, for our online web-based tools and things like this. So in order to get out of all of that, we need to just stay the course and just abide by the government regulations.
Fantastic. Thank you very much, James. That's a really nice, clear picture. And yeah, we are on the road to helping get us back to the things we love. And yeah, whether that's going out for a meal indoors, whether that's seeing your friends in other people's houses, if that's yeah, just seeing everyone. We are on the road to a better 2021, which is fantastic. So thank you very much, James. Okay, so now it's time for questions from the public. So thank you very much to everyone who has sent in your question to Navin and James over the last couple of weeks. We've had to whittle these down. So we picked the best ones in terms of the current situation in Medway. And we've got a really nice mix of questions as well. So thank you very much. Let's start off. So questions from the public. So this one, first of all, Navin, is to yourself, and it's from Elaine, and she asks, as the supply of vaccines has slowed down, will I be able to be given the same make of vaccine for my second dose? So I had the Pfizer jab in February, and I'm due the second dose in May. Or will the jabs be able to be mixed? So will I be given the Oxford AstraZeneca one instead, for example? So what is your response to that, Navin?
Thank you, Kevin. I think, first of all, before I answer that question, can I just echo James's thanks? I think what's been happening over the last year and a half has been a battle between human versus viruses. And I think every particular person who has done everything they can in order to just keep us to fight against this, get back to some sort of normality, has been absolutely tremendous. So a huge thanks to every single person out there in the community. And one of our responses has been vaccination. One of our defenses has been vaccination. One of our tools to fight against this has been the vaccination program. So Elaine has put in a very, very good question. It's about the supply, and it's about the mixing of vaccine. So in a way, Elaine's absolutely right. We know that the supply, there have been news about the supply aspect of things being affected as we went into the program. But throughout the program, and this has been since December that we've started, second dose has always been something that has been ring-fenced. So whenever the supply has been coming through, there has been an issue in terms of the first dose probably slightly being an issue because there's been a gap or a lull in the supply. But at all times, what the national team have made sure, and we've made sure in being part of that delivery and supply chain to the centers that are providing the vaccination, is that the second vaccine is guaranteed. And therefore, the answer to Elaine's question and the current advice is, if somebody's had the vaccine, which is Pfizer, then the second one should be Pfizer. Unless there has been an absolutely severe reaction, say, for example, a very severe allergic reaction, which means they had the tongue swell up or their breathing problems and required really emergency treatment, or with some of the clotting issues that have happened with AstraZeneca, unless there has been that severe reaction with the first dose, the general advice is stick to the same second dose, because that is what the evidence suggests at the moment in time. Mixing of vaccine is something that is currently being it's currently being tested. We are hoping to get the advice of what those tests mean for the future. But as we speak at the moment in time, and for today, at the current moment in time, the advice is stick to the same vaccine. The second dose is guarded. It is ensured that supply is not affected for the second dose, and therefore please have the same one.
Fantastic. Thank you very much, Navin. So Elaine, we hope that answers your question. Very, very clear there. So thank you there, Navin, for that. Right, this one is for yourself then, James. So this is all around the booster vaccine. And this is also from a lady called Elaine. So is it the same Elaine? We're not sure, but here we go. What are the plans for a booster vaccine in the autumn/winter? So could it be given at the same time as the flu jab? So how would you respond to that, James?
Well, if it's Elaine, she's got some really good questions. But here we go. So there's been an announcement, and depending on when people sort of dial into this particular broadcast, there might be further information on this. They're currently looking to determine whether and which groups of people may well be eligible for a second booster. Obviously, you'll have had your first and your second doses, so this would be another jab in the autumn time. The timing of which and who will get that is still to be considered. And also whether it would be, as Navin's just really said, either you get the same vaccine that you had previously. So if you had the Pfizer vaccine or the AstraZeneca vaccine, you might get one of or the Moderna vaccine, whether you're going to get those or another variant of that. So there's still some work for them to do to work through all of that. And the issue that you mentioned there about the flu timing is really important, because what they're looking to do is to try to make sure that we use every opportunity where we would normally be doing things with the people who are at greater risk to maximise that opportunity. So if it can be done, then it will be done at the same time. But equally, they need to make sure that all of this is in line with the best practice and safety. So they are looking at this. There will clearly be further information that will come out over the next few weeks. And I'm pretty sure it'll be a few weeks, because they are really clearly trying to plan this going into the future. But as soon as we find out any further information, we'll make everyone aware of that. And of course, you won't need to be called. There will be information that will be sent out in the usual manner.
Thank you very much, James. So more information to come. I hope that answers for now your question, Elaine. So yeah, thank you very much. Right, okay, so this question is for yourself, Navin. Okay. It's also from a lady called Elaine. I'm joking. No, it's not. It's from a lady called Julie. So Julie asks, I would like to know when will GP surgeries reopen to resume normal care? So with the great reduction in Medway of active cases of COVID-19, it seems to me that GP surgeries appear very reluctant to resume normal surgeries at the moment. So how can you reassure me, please? So yeah, so that question's from Julie. Over to you, Navin.
Yeah, Julie, thank you for the question. Very, very useful question. And I think what you pointed out is the challenge that the pandemic has brought onto the stretch of the National Health Service, including that of general practice. It has changed the way people have practiced, and it has changed the way general practice is serving the population. The first thing to be clear is general practice has never closed. It has always been open throughout the pandemic, as have a lot of other services. The way the practice is done, the way it is shaped itself has changed. Absolutely, you're right. And I think that is something that we're currently looking at the moment. So the traditional method of calling up a surgery for a face-to-face appointment is something that is not present across not just Kent and Medway, but across the whole nationally, really. The digital transformation that has happened because of the pandemic has been absolutely fast. It's been massive, and it's been something that both the clinicians and the patients have got used to. What that has, however, done is that it has allowed general practice to triage, what we call as clinical triage, our patients, in order to ensure safety of the patients who are coming into the surgery. So face-to-face appointment has always been available, but what happens is that when a patient does ring up the surgery, they are asked to be put on a clinical triage. The doctor will then clinically triage or a nurse practitioner or a paramedic practitioner, because it's not just GPs who are the workforce of general practice. There are a lot more other people who are part of the general practice team, if I may. So we have paramedic practitioners, we have senior nurses, we have physiotherapists who are all coming together to respond to this clinical triage, and then ensuring that we bring in we give the right response to the people, We then bring in people who need the face-to-face appointment for, and wherever it's absolutely clinically required, we have made sure that the face-to-face appointment keeps continuing on, and that is the plan. Now, the challenge moving forward will be how do we evolve in order to ensure that this becomes a sustainable model in the future, because a lot of people may not like the digital model. So we don't want to leave any of our patients behind. We don't want to move away from, however, we also don't want to move away from what is a clinically triaged option, which is a clinical assessment to ensure that those who need the right care at the right time get it at the right place. Really, that's the main aim. And therefore, the aim here would be to look into it. We are looking into it. We also brought in something called as electronic consultation, which is another way in which people can go online on their web on the practice's web page and then fill in a form for electronic consultation, and that will then come to the practice. Again, it's another form of triage, but again, it will help make sure that the people who need the service get it at the right place at the right time with the right person. And that's the aim. So the aim is to continue maintaining the clinical triage model, ensuring face-to-face appointments are available to those who clinically need it, and ensuring that we also recognize that those there are cohorts of patients who possibly may feel this to be quite onerous. How do we include them within ensuring that they're not left behind? And we are working with all the general practice teams. And the national team is looking as well as how that becomes a sustainable model, not only now, but also for the future, because James has mentioned the booster program that may come in September. We know that a lot of the general practice team have been involved also in the current vaccination program. What we need to make sure is have a model that allows those programs to continue, like the booster program, but at the same time, we are continuing to provide the service that is required for our patients and needed for our patients.
Thank you very much, Navin. We hope that reassures you, Judy. You know, there's lots of ways to access GP surgeries, and face-to-face is still available, and obviously that hopefully will increase further as restrictions ease. But obviously lots of ways to access the surgery still. So thank you very much for that, Navin. That was really, really clear. Okay, so this next question is for yourself, James, and this is from Jill. So thank you, Jill, for this question. So this is all around needles. So I would like to ask, when will a vaccine become available for people who are totally phobic to needles? So I've been for 53 years, and all I've ever been told is I'm being silly or stupid when I ask this. And then I'm also told I'll just have to wait until there's an alternative, which may never happen. So Jill, you're not being silly or stupid. It's a very good question. James, over to you for this one.
And Jill, again, as Kevin said, everyone, you know, my heart goes out to you. There are many people out there who have got challenges with, you know, having a needle stuck in their arm or other bit of the body, and I can generally assure you that those kind of feelings that you have about that and to be anxious are perfectly normal. What I would suggest though is that there is quite a lot of research ongoing at this moment in time, and actually the University of Sydney, Jill, are doing some work on a non-invasive, so that's not, you know, no needles or anything like that, method of dispensing COVID vaccination, actually, which does not then involve any needles being pushed into your arm. What I would say is that, and we also clearly are aware that we have at this moment in time other medicines and vaccinations that are provided without you know, not using needles. You know, if you take children's flu, for example, for the younger ones, that's a nasal sort of method of dispensing. So there are lots of different things that are happening at the moment. The main thing is that all of these techniques have got to go through a rigorous process of checking to make sure, one, that they work, that they're effective, and also safety. So the regulator has got to sign these things off as well. So watch this space. There is a process of research out there at the moment to try to make sure that we can provide vaccination for those people, unfortunately, who may well be challenged by needles. But what I would give you a sense of is, if you've got any challenges like that, please come forward for your vaccination. The teams that will stick the needle in your arm and provide that vaccination are very competent. They're highly skilled, and I've had it done on many an occasion. And you basically, I understand where you're coming from in terms of that historical thing, but we would just urge you to come forward, talk to the teams, and I'm sure Navin might also want to add some reassurance there, and they will make that process as symptom. Let me redo that bit again, Kevin. Can you do that bit? Right, so I'll start again. To come forward, get the vaccination, and the teams that are working with you will make that process as painless as it can be, and give you that reassurance before you have the vaccination, and any support after you've had the vaccination to make you feel okay, until you feel okay in that kind of sense. And Navi might want to come in on that one as well.
Yeah, no, James, you're absolutely right. I think in terms of the ground level, I've had, and a lot of my colleagues have had patients who are absolutely phobic of needles. So people come in, they're absolutely scared of needles, and you can see that in the body language. They're absolutely petrified when they come in, but they understand the reason why why they've come to have the jab. We go through the questions, we try and reassure them, and I think more 9 out of 10 patients, in fact, probably 10 out of 10 patients who come in are then looking at me to say, is that done, doc? And I think, yeah, that's done. So, and he was saying, and most people say, oh, I wasn't aware of that. That's much less painful than I thought it would be. So please, yes, I appreciate people have phobia for needles, but please don't try and go and book your appointment. There are people there who can discuss things with you, and I'm sure with the number of thousands of vaccines we're doing on a daily basis, and most of them, most people say, "Oh, is that done very quickly? That was very good." You will have a pleasant experience rather than something that is traumatic.
And to my final point, I've got 2 brothers who are extremely, how can I put it, timid when it comes to needles, and would have a similar phobia. And they've been both through that process. And actually, as Navin said, they didn't even know that the needle had been inserted and removed, and we're still waiting for the vaccination. So please do come forward, and anyone else that has got that kind of challenge. We do understand that, but the team are very sensitive, and they will give you all the support that you need in order to have that vaccination, because it will help you and clearly help all of us get back to doing the things that we love to do.
Thank you very much, both. So yeah, thanks very much for that question. And yes, do please take up the vaccine, Jill. And yeah, we really appreciate that question and your support. So thank you. Right, one more question then, and this is basically a question that we've seen a lot come through across our communications over the last few weeks around the twice a week testing campaign. So we've got a national government campaign running at the moment, and then Medway Council running a localised campaign which encourages households to get tested twice a week using the various ways to get symptom-free tests, so either at test centres or using home test kits. So the question is, and this is probably both of you actually, why should you get tested twice a week when the infection rate is so low at the moment in Kent and Medway? So I'll go to James first of all, and then Navin, feel free to obviously come in after that as well.
Well, so this is the thing. I think we talked earlier, and hopefully people understand where we're going with this, about the need to keep on top of the disease, to ensure that if there is people, unfortunately, there are people, unfortunately, who become infected, that we're aware of that. And as we know, and only too well, that you get these new variants of disease that can unfortunately occur either spontaneously within the community or be imported. So by testing and being regularly testing, and by this we're talking about the symptom-free testing, you can be assured that one, you're not infected, so you're not then going to infect other members of your household or your work colleagues, that type of thing. And secondly, of course, it gives us an opportunity, if people do become infected, to rapidly control a spread, to get in there really quickly to stop any further outbreaks and spread of disease. So rapid responses, these tests, you get your response back near enough instantaneously within 20 minutes. It's very quick. You can do it at home. You put the information in, and this is the key thing to make sure that you set your account up, and it takes a couple of minutes, because I've got to do this regularly, as hopefully everyone else is doing. A couple of minutes, you take a quick swab, put the drop on the actual test strip, read it off. It's very simple. And then you can go on about your business, assured that you are free from infection, protecting yourself and then protecting your loved ones. And the main thing there again is that we are always on top of the disease. So if we get any strange things happening, if we do see occurrence of cases that might occur in the same time and place, and people have gone into a particular space, or it involves a group of people, we can be on top of that and really support our community and protect people. So regular testing, regardless of to whether you've been vaccinated or not, is pretty critical for us to keep that assurance and surveillance to keep our community safe. And I'm sure Navin will add into that as well.
Absolutely, James. I think you've touched on most of the points. I think, like I said earlier, this is about the battle that we've got, human versus virus. And I think whilst we know that other parts of the world are still there is a high rate, we know what's happening in Brazil, we know what's happening in India at the moment in time. Thankfully, we've got a process in which the community infection rate is low. Thankfully, we've got a process in which the vaccination rollout is there. But it does not mean that the vaccine is that the virus is not in the community. And I think, like James has said, the testing will help assert a negative result that you can get on with the day-to-day working as normal, along with ensuring that you're keeping the safety measures as per the government guidelines. But at the same time, if there is a change, there is an early warning. We know we can learn early on what the change is, and then we can look more into it to say, okay, what's this happening? I still remember, James, when we were in a health protection board meeting in September, October, when we were wondering what's happening in Kent. Why is Kent not behaving like the rest of the country? Only then we could look into it and say, oh, this is a variant that's coming on, and we could give some warning to the rest of the country and do the changes that are there. So I think it's really important, whilst people feel it's tedious, like James said, I do that on a regular basis. It literally is a couple of minutes. Yes, you need to wait for the exact result for 30 minutes, but the actual process itself is 2 minutes, and you can get the result, and it will reassure you, and it will reassure you from yourself and also the spread to others in this battle against the pandemic.
Thank you very much, both. So that's really, really clear, and that's basically just completely confirms the fact that testing is so important. And please, everyone, do take up testing. It's free, it's quick, it's easy, and it will protect loved ones, family, friends, colleagues, etc. And let's keep the infection rate low in Kent and Medway. Right, thank you very much. Right, so let's now move on to experts ask each other. So this section of the video, we'd like James to ask Navin a particular question, and then Navin for yourself to ask James as well. So a particular question on your expertise. So James, I'll hand over to you first of all.
Thanks, Kevin. I think the question that I want to ask Navin, really, and this is one quite close to my heart. So my father-in-law, and he won't mind me saying this, has had a little bit of trouble managing his blood pressure, and throughout the pandemic, clearly he's been shielding. Just what advice would you give for somebody like him who has not been able to get out and about and be as active as he would do for reasons that are linked into just some general issues around his mobility? And how would you sort of give him a steer as to what would be best for him to help manage his blood pressure, and equally so looking at other risk factors that might link into his and I'll go there, his cardiovascular risk. So what sort of advice would you give to my father-in-law, and by that also anyone else that's been out there unfortunately in that kind of position?
Thanks, James. I think you asked a very important question, which is about long-term conditions, and hypertension, high blood pressure is one of those issues which has a risk factor. And the advice there are, as a doctor, I've got to give the clinical advice, which is to ensure that he continues with the medication and he is taking the medications on a regular basis. But I think, like with all ongoing long-term conditions, the clinical or the pills and potions, as I call it, is one tiny bit of the advice and the management strategy. The bigger one is for people how to look after themselves. So I think it's that lifestyle buzzword and it is about ensuring that he's keeping an eye on his weight, to ensuring he's the right, eating the right stuff, and things like salt intake is extremely important. Like you rightly said, with shielding, it has been difficult for people to go out and about, but hopefully as we come out of this, that opportunity comes back again, but to take it slowly, because people have been shielded, and especially people who are elderly population who get the muscle mass we know reduces as we do less activity. Please take it slowly so you don't have a fall and end up injuring yourself. So please take it slowly, go for small walks to begin with, and then build up from there onwards. Don't rush. Don't, after you had the pause, don't go back straight away to what you were doing before, because just listen to your body, in other words, because your body will tell you what you need to do. The other thing is about monitoring. I think traditionally people used to go to, like the earlier question that Julie asked about general practice, people used to come to practices to check their blood pressures and things like that. Currently, what is one of the positives, if I may use the word, is the ability to check and monitor things at home. If you go on Amazon, which is probably most of us have gone to Amazon for our shopping for most things, you can buy blood pressure monitors, which can monitor people's blood pressure at home. And the Amazon choice is for $16.99. I just checked it for one of the patients a couple of days ago. So $16.99 is still a lot of money for some people, but in the context of everything else, probably it is money wisely spent. Along with the other one, which we mentioned to a lot of people, would be the Christmas must-have gift, which is the pulse oximeter, which is to check their oxygen levels and things of that sort. So I think there are these gadgets which were very expensive. Which I remember it being £50 and above, or even £34 and above. The prices have dropped down. So please consider having them at home and monitoring your blood pressure on a regular basis. And that would help you look after yourself the most, listen to your body, continue with your medications, monitor your weight. And as things move on, I'm sure there will be the option of doing the blood test again, which will monitor the cholesterol levels and things of that sort. But I think that is just one part of the whole aspect of things. The bigger part is about looking after yourselves, keeping the weight, keeping the salt intake, monitoring the blood pressure, and taking the medications on a regular basis. And smoking. How did I forget? I don't know whether he smokes, but that if for the general population, definitely give up that, because that is just increases and doubles the risk factor. You should tell me off for not mentioning that right at the start, James.
I should, and it's a really good point. And he did smoke many years ago, but we stopped him. I think he's seen the bright lights now for being smoke free for about 30 years. What I would also add to that, Navin, you've just flagged it as well, is the uptake of the health check. I think the NHS health checks, when you get called for that, and we know that people who are age 42 to 74 are extending the age range actually up and down in relation to that, do come forward for that health check when you actually get called. But that's really helpful advice, and I'm sure that he's heard it, and other people potentially who are in the same boat may well have got some benefit from those kind words that you've mentioned. Thank you.
So is it my time, my chance to ask? So James, I think you mentioned about football earlier. I'm a footy fan myself. So in a way, yesterday City won against Paris. Today we've got the Chelsea game. I was considering we're today having this interview on the 5th of May. Champions League final. Lots of people. Not traditionally, it'll be lots of spectators, things of that sort. When will that come back? And when we will see those things, and what can we do in the community, each and every person, to ensure that happens?
Navin, that is the question of all questions, and a really apt one. What I would say is we hope that it's, and by the time this comes out, let's see, we'll find out that an all British team final, so it'll be English teams in any event, because we know that the other home nations unfortunately have fallen by. So we know that we've got at least Manchester City through, and hopefully Chelsea will come through. But the key point there is about getting back to doing the things that we love, going to outdoor events or indoor events where you can do mass gatherings. So we have got the roadmap, and the roadmap says that from the 17th of May, then we'll start to be able to go back inside again. There'll be some controls in place in terms of capacity of venues and that type of thing, and wearing face coverings. But the bit for us to look forward to really is the 21st of June, and that is only weeks away. If we can keep our rates down, if we can maintain the same course of action that we've been doing and across Medway and the wider system, clearly in Kent, because we know that there is clearly a very tight interface between our populations, that's when I'll be able to go back to watch the Gills. And thanks, Mr. Scally, for all the support that you've provided throughout the pandemic and allowing us to use the football stadium, which is why I go back to that point, as a testing venue. And we were able to do that because it's part of our community. So I believe we're on track to go towards that destination. I want to go back to some of the open air events that we used to go to, whether that's the proms in the park. You know, we've got castle concerts that we used to have in Medway and other such things, and just that whole thing about being able to normalise our lives. So the roadmap's there. 21st of June is the date and point for us. That's when we've got to sort of think about normalising. The week before that, so now, is everything that we do today will impact on us tomorrow. So stay the course, and I believe by the 21st of June you'll be able to go out into the park, go to a club, a pub, be able to meet with your friends and strangers, and clearly just do human things that we have been striving to do over the last sort of 15 months and not being able to do because of this pandemic. So let's hope that we've got an all English team final, and I would love to get a ticket, but it's out in Istanbul. I don't know whether international travel will have impacted us by then, but by the time this comes out, we should know. But that would be my timeline, having 21st June. Weeks before that, we should be in a clear stead. And from what I can see from the data and the evidence, because that's what we're using to inform that decision, we are on track at this moment in time. To stay on track, everyone's just got to keep doing the things that we want you to do, because you're doing that for us. I'm doing it for you. Hand hygiene, face coverings, you're vaccinated, you're eligible, please get vaccinated. Even if you're vaccinated, regular testing twice a week.
Thank you, James. Let's hope we get there. Absolutely.
Yeah, fingers and toes crossed.
Absolutely.
For sure. And I think it's interesting, isn't it? Because we've lived with this virus now for well over a year. I mean, I went to the shops last weekend to buy some jeans. Desperately need a pair of jeans. Even though I've probably got 20 pairs. And it's just so weird to go now. And we shouldn't think that these things easing up again are not normal. That in the current situation, this is not a normal way of life. We need to get back to obviously doing the things that we all used to do, routine, socializing, etc. And to kind of get away from the last year of massive challenges. But to do that, we've just got that final hurdle, haven't we, to kind of overcome.
Yeah.
And that journey, I think, those points, we've got to learn as well, haven't we, from the things that went well. I mean, what I have seen is that the pandemic has brought people together. Our social prescribing programs, people that have been self-isolated. We know we've had over 16,000 people in Medway that are being shielded and clinically extremely vulnerable. We've wrapped around them, the communities come together. I know in Navin, in Kent and in your area, naturally, it's been exactly the same thing, where people have come together, they've started to help each other in times of challenge and distress. And so we need to build on that community spirit. And the way to do that is for us all to just reflect on where we've been and where we're going. And that means that, you know, we can all stay the course together. And that's, for me, the critical thing. Those points that you made, Kevin, about just going down to the shop without having to book.
Yeah.
What about that then? Well, we could do it, but it does mean that we just have to keep doing these things. And people have been really resilient, and just a little bit longer. Few short weeks and we will be able to line. And Navin, I mean, your reflections, you've clearly had some significant challenges in terms of having to adapt. I mean, you're a GP, your day job is to sit with people, to listen, and you still do that. I know you still do face-to-face, but sit, listen to people, diagnose that issue, which sometimes isn't the issue that people have turned up with. It might be other things that have brought that together, and that human contact thing as a job in primary care physician, you must really be challenging yourself now to say, I want to get back in there, but clearly there are still some barriers that mean that you need to be able to do that safely.
Absolutely, and I think you're absolutely right. I think when as a medical student, that was a long time ago. I think when the dinosaurs roamed the planet when I was that. But yes, I think a long time ago when I was a medical student, it was all about face-to-face appointment, seeing people, getting the history, getting the examination and things. This is a challenge for clinicians as much as it is for patients as well. But I think needs must. What it portrays is what we as humans have done ever since evolution. Ability to fly, ability to make new things, ability to have smartphones. Things change and we have evolved. I think this has tested us. It has evolved. We need to, then we won't go back to where we were as per normal working, normal cultures, normal things. That's going to be some changes, but we will thrive. We will hopefully use this as a challenge that we can learn from and build up to ensure that we can do the best we can over the coming years, when this virus will still be part of our lives, but we are able to work and play and live our lives in terms of as normal as possible with it.
And I think that last point, Navin, is really important, that the challenge for us all is to recognise, you know, we got things like seasonal influenza. We've just adapted to that, and seasonal influenza causes in bad years some significant problems within our systems and can unfortunately take people's lives as well. But we've learned to live with that. We've got countermeasures. We've got the vaccines. We know now how to deal with COVID, and regardless of that, you know, I think the points around our well-being, because that again is something pretty critical for me. Everyone's learnt how to hopefully look after themselves. When I go out, you know, doing the exercise, I see so many more people out walking the dogs, in family groups. You know, some people jogging, some people just walking, doing whatever they're doing, and understanding that being outside, getting fresh air, you know, communicating with other people as you're doing that is really beneficial to your well-being. And they're the kind of things that I'm taking away just from my own personal sort of experience, to be fair, from the pandemic, and that I'll keep doing those kind of things, and that's my sort of mantra. And unfortunately, I'm going to point my finger at you now, Kevin, because I remember when you made me do the Medway challenge and go through all the exercises with our online team. So I'm just signposting there again to the support that is available for people that are either having challenges with understanding where they need to start to maybe get themselves a bit active, or to do things, or to do new learning. We've got our adult education classes. We've got loads of other things that will stimulate people, even if you just wanted to learn about, you know, knitting and things like this. And I say knitting and things like this, you know, if I could knit, and I do want to learn, it would have been so beneficial for me, just for the times that you spend sometimes sat there listening to things and doing what's what. But having a new pastime, finding something new to do, that's the takeaway for me from this pandemic. It's been a challenge, and it still is a challenge, but you know, my thoughts again go out to all those people that have got through this, that have had the challenges, that unfortunately have lost loved ones, and the way in which we're now coming through that together. At 21st of June is the date, and let's all get there together.
Thank you very much indeed, both. And yeah, I'll make sure I put a knitted Christmas jumper from James on my Christmas list this year. So indeed. But yes, thank you very much. And yeah, there's a range of services and activities across Medway which are accessible online. So do check out the main council website to find out all about those areas. So that's medway.gov.uk. Right, so to finish up, we're just going to do a quick fire round just on some final points around testing and vaccines. So this basically is just around dispelling some of the myths that are out there on social media around both the testing and vaccination process. So first of all, and anyone can answer this. So why should you still get tested after you've had a first or second dose of the COVID-19 vaccine?
So quick fire, hit the button, because two reasons. One, it's the right thing to do for your community and for yourself, because we need to understand whether the new variants, which may or may not emerge, are present within our community. So we need to have surveillance. But the second thing is, of course, no vaccine, and you mentioned after the first dose, you've got to wait a period. I think off the top of my head, it's depending on the type of vaccine, it's between 21 days or 27 days, I think it is, for the vaccine to become effective. So in order then to make sure that you have not come into contact with the virus and you're not infected, it's really important to get tested twice a week. And I'll hand over to Navin because I'm sure he wants to add into that one.
Very simple, to keep yourself and your loved one safe. James has explained the details. Yeah, it's about safety. Absolutely.
100%, absolutely. No, thank you very much. And yeah, it really is because yeah, as mentioned earlier in the call, yeah, 1 in 3 people who have COVID-19 display no symptoms, and yeah, that fact is still absolutely 100% true. So yeah, it is vitally important. Thank you very much. Okay, right. Second one. So there is information on news outlets around the accuracy of the symptom-free tests, which technically are also referred to as the lateral flow tests. So just how accurate are the symptom-free tests that are available through test centres and also home test kits?
So if I go first to that one, James, you can correct me if I got. So none of the tests, any tests are always 100% accurate. So the way I see it is, this is a test to check whether you're negative or not. It's more about negative results. So if you're negative, it's quite likely that it's going to be negative, whether you have the symptoms. Because remember, it's a virus, and you can have the same symptoms with another virus. So if you get tested, you're negative, it's quite likely to be negative. If you're positive, obviously you need to get it tested further again, but make sure it is about the negative test, especially if you don't have the symptoms. The result that is quoted, I've checked up some of the figures that are done, is about 98% if you don't have the symptoms and it is negative. So it is about making sure that you are negative when you don't have the symptoms, because this virus can be within you without having the symptoms as well.
Really spot on, Navin, and the only other bit to add to that is the context. The technology that we use is new and it's novel and it's emerging, but all of these tests have been through a very rigorous process with the regulators to then be able to be used in the community. They have to be signed off. So the guidance is pretty clear in the way in which they need to be used. The symptom-free tests are about finding out, as we've said, 1 in 3 people may be infected but not know it, because you might not display any symptoms at all. And of course, as Navin said, sometimes the virus takes a little bit of time once you've been infected to get to a high enough level so that it can be detected by these tests. So the symptom-free tests, as Navin said, they're very good at telling that you haven't got it. They're pretty good as well at telling you whether you have got it. And the belt and braces that you get a second PCR test, that's a lab-based one, that the sample gets taken and then gets sent off and analysed in a lab that will definitively tell you whether you're infected or not. So the stuff that's out there is perhaps misunderstanding the reason why we use the symptom-free test, the lateral flow devices, which is to identify early people who potentially may be infected and just not knowing. And as you said, 1 in 3 people have got that. So if you're negative, you can say that you are negative. If you're positive, most likely are, because we've had some good reports that have come out on the efficacy, the accuracy of the lateral flow devices compared with the PCR tests that are used, the lab-based ones that get sent off, and there's pretty good alignment between those two tests. But the main thing is that they're being through a rigorous process, they're being quality assured, they're continually quality assured, and no test is 100% accurate every single time, but these tests are as accurate as they need to be, the lateral flow, the symptom-free ones, to do the job that they're intended to do. So we're pretty confident in the use. We've had over 1,300 people at last count who we found to be positive, who did not know that they were positive in Medway alone, through the lateral flow test. So as near as I can see, that's 1,300 people and their families and close contacts that have been able to self-isolate and reduce the likelihood of transmission. So everyone needs to keep doing the testing twice a week until we get to that point, which hopefully will be soon, where we may not have to do that. So keep testing, they are accurate, keep using.
Fantastic. So yeah, so let's keep getting tested is the ultimate endpoint there. But yeah, thank you very much both. Final point then for today, and this is around the vaccine rollout amongst younger groups. So obviously we are now for the up to the over 40s who can now book their first dose of the vaccine. If anyone in younger cohorts are still hesitant to get the vaccine, or may have already decided, you know what, I'll just, I'm not confident, I don't want to get an appointment, what would your advice be to those people?
I'll go first if that's okay, James. So I think, I probably am repeating it again. So this is it's a pandemic. It's changed our lifestyle. It's changed the way we meet each other. A lot of people have lost their loved ones in this. Vaccine is our only fight back. Let's be honest. The other alternative is we just stay at home and we don't meet each other. But that's not the way we work. We are human beings, are social animals. We like to interact with each other. We like to meet each other. So if we have our vaccination program is the only fight back we have against the virus, and please therefore be really considerate about why you're choosing not to have one. My advice would be, please book it. Definitely, please book it. If you have any concerns, there are clinicians there who can discuss it with you, but don't waste the opportunity to not have the vaccine, because we know that especially in the second wave, whilst this is an illness that in the first wave has had a lot of people have lost their lives who are in the older population, by which I mean over 70 and over. In the second wave, we still had people in the 30s and 40s who were really, really poorly and unfortunately have also lost their lives. So please do not consider, because I'm young and I'm healthy, this is not going to come and affect me. It may do. The only way it may not, or you may get a very mild illness, is by having the vaccination. So please have the vaccine.
I don't think there's much more to say other than that the public health family and public health as a specialty, and vaccination is one of the key tools that we've used throughout the existence of understanding how certain diseases, pathogens infect our bodies, and the way in which we can protect ourselves. If you've got a vaccine that will stop you becoming ill, regardless of the fact that you might have some reservations about it, prevention's better than the cure. And as Navin said, we've seen younger people with long COVID, debilitating disease that can affect them, gives you fatigue and other problems in terms of respiratory problems, muscle problems, a whole range of other symptoms. And that clearly is not where we want to be. Young people are more likely to be out and about, engaging with other young people, who are then more likely to be going back into the households with other people who may be more vulnerable, which could be a parent, your grandparent, your aunt, your uncle, or other younger people in your family, or visitors to your household. So the whole point about being vaccinated is, one, clearly it stops you as an individual having to go through the challenges that Navin's really aptly described in terms of the problems that could occur, including fatality. But secondly, it's about the community, and we're all in this together. The whole point about this is we are in it together. Everyone lives and breathes the air. Everyone goes to the same spaces and places. And what we've then got to do is to do our bit to make sure that you are vaccinated. Both Navin and I have been vaccinated. We know that to be the case. I'm protecting you. Protect us. Everyone should get vaccinated where that's indicated. And if you've got any worries or concerns about what's in the vaccine, you know, what the side effects might be, whether you're going to be, you know, have a sore arm or whatever else after it, you know, all of these things, we've got really good people who can talk you through it, explain what these symptoms are, and the fact that you feel a bit rough is a good thing sometimes, because that's your body's immunity kicking in and building, you know, that those memory cells. We won't get too technical with this stuff, to protect you against that future real infection that is COVID. And we do want to make sure that we can draw a line under that as quickly as we can.
Thank you very much. So yeah, so do go to nhs.uk/coronavirus, where you can then find details on the latest cohorts who can come forward and book your first dose of the COVID-19 vaccine. I mean, it's got all the various details around what to expect. So yes, please do check that out. And that brings us to the end of today's session. So thank you very much, everyone who has watched today. My thanks to James and also to yourself, Navin. Really appreciate your time answering all of these questions and hopefully creating a clearer picture to viewers today on the state of play in Medway and the way forward to a better 2021.